Now, good morning, good afternoon, good evening, colleagues and friends, wherever you are. Today, we are going to have another important topic that will be addressed in this webinar, which is combating the influenza viruses. I think this is a very, very important topic as far as we are approaching or entering the winter time, where every flu season, really the number of people who get ill from the various influenza viruses increases. The flu viruses affect people differently. While some are mildly affected and may miss school, work, or social event as they rest and recover in a few days, other people are severely affected and are hospitalized or even die due to influenza complications. It is hard to predict the severity of the seasonal influenza viruses and the number of people that they affect each year. However, being fully prepared for combating the influenza viruses every season play an important role in reducing the burden of the disease and losses associated with severe illness. Populations, especially at-risk groups, are best protected by the annual seasonal flu vaccine. The influenza is proven to reduce the severity of the disease and dramatically reduce the number of hospitalized patients. Nevertheless, the number of people who demand the vaccine is still low, and influenza remains one of the priority public health threats worldwide. This webinar will focus on the base approaches to battle the influenza viruses in the Eastern Mediterranean region, with a specific focus on Eastern Mediterranean region country experiences in responding to seasonal and pandemic influenza. In addition to that, the challenge of influenza vaccine hesitancy will be addressed by providing evidence-based approaches to communicate the influenza vaccine to different population groups to increase the demand and coverage of the influenza vaccine in the Eastern Mediterranean region. In this webinar, we bring experts together to provide an epidemiological and situational update on seasonal influenza trends in the Eastern Mediterranean region. Secondly, to provide an overview of the GCC countries' experience in responding to seasonal and pandemic influenza, emphasizing the successes, challenges, and lessons learned. And thirdly, to provide an evidence-based overview of the influenza vaccine advances and its role in reducing morbidity and mortality of the disease. And finally, to recognize the challenge of influenza vaccine hesitancy and suggest evidence-based approaches to increase influenza vaccine acceptance and uptake. Allow me first to introduce our first speaker of today's webinar, Mr. Noor Alam. Mr. Noor, he is the regional focal point for influenza and other high-threat respiratory pathogens of epidemics and pandemic potentials within the WHO EMRO based in Cairo, Egypt. He holds 3 master's degrees, in fact, in applied epidemiology, public health, and social sciences, and he currently pursuing a part-time PhD at Griffith University. In 2021, he was the contact tracing and quarantine sub-pillar lead within the WHO headquarters COVID-19. He also worked extensively in various technical and managerial roles with international organizations, particularly WHO, UNDP, Woodford Program, and also at the United Nations Technical Authority in Cambodia. These international roles range from the capacity building in health services to the disease prevention and epidemic responses. Dr. Noor, you have 15 to 20 minutes to have your presentation, and we will keep all the questions and answers after completing the 3 presentations. For all colleagues, if you have any questions and answers, you can see down a box for the question answer where you can put these questions there, and hopefully we are going to address all of them after completing, as I mentioned, the 3 presentations. Dr. Noor, the floor is yours, please.
Thank you, Dr. Faris. Good morning, good afternoon, good evening, colleagues from around the world. In this presentation, let me open up my presentation. Can you see my presentation? Can someone confirm, please?
Yes, and if possible, to put it in a slide.
Is it all good now? Can you see?
I can see the slide, but it is better to put it in a slideshow, please.
Okay.
Yeah, perfect. Thank you.
All good. Okay. All right. So, excuse me. In this presentation, I'll speak about some of the key epidemic features and the disease burden for influenza and the other respiratory viruses in the Eastern Mediterranean region, and also WHO EMRO's support to member states in relation to influenza, both seasonal influenza and pandemic influenza, influenza vaccination, prevention, and other protection measures. All right. WHO Eastern Mediterranean region, or EMRO, is a complex region, challenging and contentious region in the world. In this region, the region is characterized by countries with emergencies, both natural and man-made, with outbreaks and epidemics, conflicts, refugee crisis, and instability. Infectious disease in this region accounted for 1/3 of the death and illnesses, with lower respiratory infection, which includes also influenza, the third leading cause of death and fourth leading cause of the burden of disease in the region. Specifically, the region is exposed to significant health security threats from respiratory diseases, including influenza, MERS, respiratory syncytial viruses, and also currently the COVID pandemic. As for the not just the influenza diseases, but there is non-influenza seasonal viruses such as the respiratory syncytial virus, or RSV, which are responsible for substantial disease and economic burden annually in this region and also globally. So at the global scale, there are 33 million infections annually, just only from the RSV infections, resulting in more than 3 million hospitalization and over 26,000 hospital deaths in children from 0 to 5 years old. In infants, particularly less than 6 months old, about 1.4 million hospitalization and over 13,000 in-hospital deaths. 3.6% of the deaths in children from age 28 days to 6 months were attributable to the respiratory syncytial viruses. As you can see in the map, so it is widely spread across the region and globally. In this slide, we'll look into the trend of the pattern of distribution of influenza viruses in the region. This is from the Southern Hemisphere, not our region. So the Southern Hemisphere includes Australia, New Zealand, and the Southern American countries. So the seasonal pattern, in Southern Hemisphere, the flu season starts from March and it runs to October for the year, the same year. So which is just ended in the Southern region. So as you can see from this graph, the pre-COVID peaks in the seasonal flu in 2019, there's a high peaks, the seasonal peaks, and also the drops heavily during the 2020 and 2021 at the height of the COVID pandemic. And then they started rising the case number in early 2021 to whole of 2022 and beyond. So the season just ended this year is characterized by moderate to mildly severe cases, both in terms of the number of cases and also the severity of cases. So as you can see, the case sharply increased in the peak of the season, and then also it lasted quite long compared to the other season, the pre-COVID seasons. So we will look into now the comparison scenario in the Northern Hemisphere, how it looked like, which includes also our region. Now, if you look into pre-COVID peaks, there are some, the two beautiful, like almost symmetrical peaks before COVID. And then you can see almost like nothing during the first 2 years and at the height of COVID pandemic in 2021. and part of 22. And then the case number have started rising. And there are two humps you can see into 2021, 22. So the it's clearly is visible. There's a pattern in the southern hemisphere and also northern hemisphere. But although, so if we compare the southern hemisphere with EMRO region in our region, so it is very similar pattern, although it's a non-symmetrical and non-overlapping pattern because of the seasonal differences across the two regions. In our regions, you can see almost like a same pattern, pre-COVID height, and during COVID, the case numbers, came down to almost like nothing, zero. So very few cases were reported. But as the 2022 season started, the case number has started rising, and then suddenly in the last few months, couple of months particularly, the number has shot up quite dramatically. So we will see the next slide, which will show you some differences with the number, and particularly the percentage positive numbers. So it's the similar, the top graph shows the similar pattern. This is from our region, in EMRO region, and pre-COVID, during COVID, and also the last several months during the COVID time as well. If you look into the middle figures, the numbers, the percentage positive, which is measured by the total positive for influenza over the total sample tested. So you see the pre-COVID, seasonal pattern. It shows over 20% of the percent positive rates. But as the during the COVID, the number came down, the percentage came down to very low 2%, and then suddenly increased to 8%. And then now in October alone, it has shot up to 32%, which is a huge number. So the top graph is a little bit older, so I'll show you the next graph. It will show the differences. This one, if you look into the first two non-seasonal pattern, very low number of cases. June to September in our region is regarded as non-season or out of season. So we naturally expect very low number of cases, although influenza can occur anytime during the year, and it does. So the low number of cases in the before pre-COVID, normal, so-called normal off-season rate. And if you look into the same period over this year, June to September, which is also supposed to be very low number, this is not the case over the last 4 or 5 months, June to September. You see the number has risen quite dramatically, quite high number. So this is the sign of the early start of the season in our region, and not only early start, but early but very strong start of the season, signaling that this season might be worse than before, after the 2 years of relatively very low activity in the seasonal influenza. So zooming in this last 4 or 5 months of the influenza activity, you look very clearly that there are a bit of long, early start, but longer, continuation of the number of cases reported in our region. So in all, it looks like it is not a very good signal for the season, and we have to get ready for the worst, to embrace the worst in this season. So what is our strength? So our strength in our region, when I say region, this is WHO Eastern Mediterranean region, spanning 22 countries, as you can see in the map. So our strength is that over the last several years, particularly during the COVID period, there has been substantial investment made by WHO to improve and strengthen the capacity, country capacities to deal with seasonal influenza, pandemic influenza, and any other emerging respiratory viruses. As a result, we have out of 22 countries, 21 countries have the functional influenza sentinel surveillance system, SARI, ILI, and other respiratory viruses as well. We have national influenza centers or influenza laboratories across all the countries, 21 countries. We have our member countries have the capacity to now conduct the genomic surveillance of all the 21 countries out of 22 countries. 18 countries now share virus through the national influenza centers, which goes to the WHO collaborating center and leading to the GISRES. 16 country report influenza data to WHO global and or regional platforms like FluMart or mFlu. 13 of the country have a very clear written national seasonal influenza vaccination policy. So these are a very recent development in terms of the number of countries that have strengthened their capacities. And thanks to WHO and the other partners' support and the countries' extra vigilance and also the country's leadership and commitment to the investment. So in all, we are getting ready for the season, and we are acknowledging from the previous record low number of cases in the last 2 seasons. So that is likely to surge the case numbers accordingly. We are planning and preparing, and which is vital. So flu viruses change constantly. Influenza, as Dr. Faris mentioned, that is very uncertain, and the not just the seasonal activity, influenza, activity can continue during the whole year, and also it can turn to very nasty with the new variant can emerge, and it can go out of control as well. So therefore, planning and preparedness are vital. So the critical elements, which is the trio, epi, lab, and the vaccine, these all components should work together nicely and harmoniously. So we need to review the preparedness mechanism of how these elements are functioning to ensure the prevention and protections are doing their jobs. So we need to check also to ensure the lab supplies, stockpiles are adequate across the countries. It is the national, the responsibilities as well as our regional efforts are also invested, and we are looking into together with our member states. So we are ready to share, and we would like the countries to also check their readiness to share data timely through the regional or global platform. It's very important that we share the influenza data across the region through our regional platform and also globally, because in this age of globalization, no country can survive alone. And when it comes to the pandemic preparedness, we must share the information globally through this platform. So we need to ensure that we expedite influenza vaccination through targeted approach. Particularly the WHO recommended target the risk group, pregnant women, children, those who are aged 6 months to 5 years old, very old people, and people with the chronic conditions. So these people should be targeted for vaccination in the first place. So when it comes to the surveillance, it is very important to consider the case definition for influenza. And so the influenza comes with the ILI and SARI case definition within the surveillance system. So the countries must ensure that when the case is being registered, it follows the WHO, the global case definition, which is for the SARI and for the ILI. These are the features. And these case definitions are standard, and these are available at the WHO website internationally. So it's very important because consistency, both the reliability and validity of the case definition is very important, that every country follow the same way when they register or the identify cases. So EMRO support in this season. So we are getting countries prepared for the current season. At the beginning of this season, we organized 2 webinars. We deliver one for the seasonal influenza preparedness and one for the pandemic preparedness webinar, which member countries and our partners and people from other regions globally also attended those webinars. So we are helping countries to operationalize the integration of multiple pathogens with influenza, COVID, MERS, RSV, and other respiratory viruses under the one and the established surveillance, which is the sentinel surveillance system. So we had a mission, 2 missions we sent to Iraq and Morocco recently, assisting countries looking at their surveillance system, existing surveillance system, identify any gaps, and we are working in a participatory manner with the country itself, WHO at the 3 level, country, region, and headquarters, and also bringing partners like, for example, US CDC. So we were jointly assessing the country's capacities and in terms of integrating the disease surveillance, influenza, and other respiratory viruses in the existing sentinel surveillance system. So when it comes to the protection, particularly prevention and protection, vaccination is the key. Vaccination is the most effective way of controlling and protecting population from influenza and influenza infection viruses. So influenza seasonal vaccination is safe and effective vaccines have been used for many years around the world. So WHO promotes seasonal influenza vaccination program with target group, at-risk group, health workers, individual with comorbidity, underlying risk factors, older population, and also the pregnant women as a targeted risk group. So seasonal flu and also the COVID vaccination can go together. So co-administration is safe and there is no adverse effect, no additional adverse effect for administering the 2 vaccines together. Co-administration does not have increased adverse risk, and also it has been widely used already across countries for the last few years during the COVID pandemic. So EMRO build the capacity and provides strategic, operational, and other supported to the region, and our region is on top of this, and we are working together with the countries and also our strategic partners and technical expert as well. So our region we are continuing to assist member state to develop and update their pandemic preparedness plan through working together with the technical expert globally, and also through our regional and also the global technical colleagues from WHO as well. So having a national pandemic preparedness plan is very important. It provides a framework for national government, and not only government, the private sector, also non-government working together within a framework, how this coordination happened, for example, and how different functions work during the pandemic or at the start of the pandemic to control and contain the disease in question. So EMRO delivered an influenza burden of disease workshop in August, which was attended by 3 countries, Egypt, Lebanon, and the Kingdom of Saudi Arabia. And also in the end of this month, WHO is offering a regional technical meeting on the respiratory syncytial virus, RSV meeting in this region. So in terms of the EMRO support, again, to continue influenza vaccination sub-regional countries, we have a meeting bringing countries in the region for influenza vaccination in July. We support countries to procurement of lab equipment and consumable to ensure the stockpiles are all good and ready. We provide technical support to enhance and reactivate sentinel surveillance system and integration as a focus, integrating multiple pathogens under the existing surveillance system. So EMRO is providing technical support for reporting to MFlu, the regional flu reporting platform. It is managed by WHO EMRO region here at the influenza, the team, by the influenza team. So we are ready to provide any technical support. We have been providing technical support to our member states. So please reach us if you need any assistance. Particularly this message is for the influenza laboratories and also the influenza focal points. So we are also promoting educational and advocacy materials about influenza and other respiratory viruses. And these are widely available through the public domain. These are some of the examples of our available resources, technical guidelines, guidance, educational material, data, and also the link to the resources do necessary other resources for influenza and other viruses. Just a quick view of the current influenza monthly update. So this is the report for October. So we produce this bulletin and publish it through our website. So these are the readily available, very handy data. You can look into some of the, both the monthly data for October, for example, and also interseasonal activity and data also that country reports with some interpretation with epidemiological interpretative text also included there. So please visit those and get some necessary information from those. I think in summary, then seasonal, the current flu season can be worse than past season based on the experience from the Southern Hemisphere and also over the past 4 or 5 months worth of data that shows the sudden increase of the number of the influenza cases. So we must be very vigilant. So experience from Southern Hemisphere can be used as an indicative. It may not necessarily reflect our region. It can be, good or bad. If it is good, well and good. But we should always be ready for the worst to come. So accordingly, our preparedness should be there. So EMRU countries have built already the capacities much better than we are much better than before COVID or during the early days of COVID. However, there is no room for complacency. We must continue our effort in terms of surveillance, prevention, and protection measures, including vaccination. So critical review of preparedness is very important that we review consistently, we check and review our preparedness, identify any gaps, and fix on time. So up-to-date operational guidelines, strategic, the strategies and the critical epi lab and the vaccine elements, the trio components should function harmoniously. We should have trial and test that these functions are all good and working. Timely data sharing, again, is very important that we not only collect and preserve our data, but also we share globally, regionally and globally. So please use MFlu and FluNet and share your influenza and other respiratory disease viruses information. So sustained EMRU support to countries will continue. So we will continue our support, but all we need is collaboration and also timely information exchange and also contacting us if you need any support or any information related or material support. So I think that's it. So you can reach us through this email. This is a generic email, but in our website, you can find all the means to collect more information and reaching and requesting more information to us. Thank you very much. I'm happy to answer any question at the end of the other presenters' presentation. Thank you. Over to you, Dr. Faris.
Thank you so much, Dr. Noor, for this great presentation indeed. And I'm sure there are some questions have been raised on the, unfortunately, they put it on the other side in the chat rather than the Q&A. So I'm asking all the colleagues who would like to ask, it is better to put it in the Q&A box. Now we are going to address a second topic indeed, which is the overview of the GCC experience in responding to seasonal and pandemic influenza. And we are here with Dr. Salah Al-Awaidi, and Dr. Salah is a medical doctor who holds a master's degree in epidemiology with the office of the Undersecretary of Health Affairs in Oman, the Ministry of Health. Dr. Al-Awaidi, between 1997 and 2012, really, he was the director of the Communicable Disease Surveillance and Control in Oman, MOH. Under his leadership, Oman achieved polio-free, measles-free, rubella-free, and CRS-free as well, and neonatal tetanus elimination and control, and near elimination of hepatitis B and other vaccine-preventable disease like tuberculosis, as well as with schistosomiasis. In 2012, he was honored by the CDC as the highest achieving person in Oman. Dr. Salah, you have between 15 to 20 minutes to have your presentation, and after that, inshallah, we are going to have a presentation from a colleague from the CDC. Please, Dr. Salah.
Okay. Assalamu alaikum. First of all, I'd like to thank my friend and my colleague, Dr. Faris, for the sweet introduction. And I would like to start by saying that, personally, I have many hats, and one of them, Dr. Faris already said, but the other hat is I'm a MENA Essential person. This is the new nonprofit organization that has been launched sometime in 2019, aiming to support country preparedness and response to influenza pandemic in huge areas covering Middle East, Eurasia, Africa, influenza, and Africa as well. Well, to begin with, my presentation basically will cover as much as possible, as you have already heard, is the lesson learned and what we have been doing in our regions, particularly I'm referring to the Gulf countries, and particularly during the COVID and post-COVID-19 with respect to influenza. And this is a guy that we are always looking after him, keep changing his coat, and keep putting us in our toes all the time. So my talk will be around giving you an overview of the GCC country experience in responding to seasonal and pandemic influenza, and emphasizing as much as possible the successes that we had, challenges and lessons learned over the years. Well, many of you are aware that the GCC countries comprise of around 6 countries, namely Bahrain, Kuwait, Qatar, Oman, Saudi Arabia, and UAE. And these countries, in fact, command abundant of human natural resources, enjoying very good living. But at the same time, we are having a huge number of non-nationals living with us. Some of the countries are having up to 40%, for example, my countries, to up to 90% in other countries. So wherever we implement the influenza program, these individuals need to be considered, and has been considered a lot, and do have a lot of burden in our system, particularly in relation to influenza. Well, as you all aware that the influenza is a serious health concern that is often underestimated, particularly among healthcare workers, and has been shown to be a severe and destructive and deadly than commonly been known and recognized by all of us. And over the years, influenza has been shown to occur around with attack rate around 5 to 10 among adults and 20 to 30% among children. And annually, we do receive a huge number of mortality and morbidity across the world. And our region, particularly our region, is a bit experience a low burden in terms of mortality compared to other regions. But again, I'm absolutely sure this is underestimating. We do have a huge burden, and particularly I'm going to refer it to this year. Well, with all the knowledge that we had over the years and the huge burden that we are suffering in our countries, the WHO has listed the influenza as one of the top 10 global health threat in 2019. And we need to remind ourselves, because this is an effort that has been done by the global WHO to remind us we are suffering from the disease that devastating our system, cause a lot of burden in terms of morbidity and mortality, and we need to take efforts towards as much as possible controlling and be prepared, as Dr. Nouri said in his presentation. And I believe that with all the experience that we had during the COVID-19, this problem could be handled much better. Well, I think Dr. Noreen has already said a lot with respect to how our region has experienced over the years with influenza. And as you can already see that in the last 2 years of COVID, hardly we have experienced our region a devastating influenza, and this is quite clear. The reason behind it is due to the widely implementation of non-pharmaceutical intervention that has been done by the country. That's absolutely clear. And as you have also seen this slide from Dr. Nurin, that over the now our region is really boosting the influenza activities, and this is quite personal. I believe this is quite expected, because over the 2 years there were hardly any activities of influenza, and the community per se have resulted in low immunity. Therefore, we are expecting this year we have very devastating influenza activity post-pandemic COVID-19. Well, this is a slide showing the GCC country seasonal influenza in the post-pandemic, and very much you could see that we have already started see the activity of influenza sometime by August, and really boosting, and over the last few months, particularly November, September and November, and all the countries have experienced influenza. Particularly, I could see the worst scenario that you could see from Qatar, which is peaked very high, and then Oman, and then United Arab Emirates, although Bahrain have seen a bit lower activities, but again, it's just a matter of time. So our region, the Gulf region, is experiencing increased activity of influenza started from August onward, and we are really expected that we're going to have very worse influenza activity over the next few months. So look at the success that we had over the few years with respect to influenza activity. I think, as Dr. Nurin said already, that the GCC countries, along with the others, they had a very good functioning influenza surveillance, and some of them do have national influenza center that producing a good data that really representing not only the country's situation, but even the regional situation. Well, if you look at one by one, I'm going to go through the countries and see where are we and what have we done with respect to influenza. Particularly, I'm referring for this year. So if I start with Qatar. Qatar, with respect to policy, Qatar do have a policy universal influenza vaccine, which is among the unique GCC countries providing influenza seasonal vaccine to all people living in their territory. And this is something that I'm really, really proud of this country to think of that. And looking at the data that has been produced based on the publication that has been done by D'Souza, unfortunately, the coverage rate for all the high-risk group, as you can see over here, the coverage rates are relatively low coverage rate despite of availability of vaccine across the country. So this is really give us a lot of hint that Qatar is suffering from one of the big issues related to hesitancy. And looking at Kuwait had, as you could see over here, increasing activity of influenza over the last few months, as you could see over here, and particularly increasing not only the influenza activity, even the other respiratory diseases, as you could see based on the data produced by the Ministry of Health, have really increased over the time. And based on that, they have released a policy, which is, I believe, is quite interesting and very good policy to vaccinate all the high-risk groups, and the campaign already started. And as you could see, the good thing, although the last few years the uptake of the vaccine was relatively low, but last 2 years it seems to be the uptake is really picking up very well and very good. Well, in Oman, as you could see, this is a blue line. We are really shooting towards experience a very devastating influenza. As you see over here, we are picking up, and personally, that I know that we are not only we are experiencing influenza, we also experience RSV among pediatric age group and other influenza and other respiratory diseases as well. And the policy has been released already to vaccinate all the high-risk groups, and the campaign in place already. Looking at coverage rate over the years, and it seems to be we are in Oman doing pretty good to have a very high coverage rate among high-risk groups. Particularly, I'm referring to the pregnant woman, I'm referring to the elderly, and I'm referring to immunocompromised. Otherwise, if you look at the person with underlying conditions over here, the coverage, this is the red bar over here, have been increasing, but hasn't been to the rate that we are ambitious to reach. So again, there's a lot of efforts need to be done to overcome the hesitancy that we are experiencing in Oman. Of course, in Oman, we had undergone the disease burden, and this was the first GCC countries to produce the evidence that the influenza is one of the a huge burden in Oman. Well, this is again to go to a UAE. UAE also has released a policy to vaccinate the high-risk groups, and as you could see, I don't have any data with respect to vaccine coverage rate now or previously, but one of the things that when I look at the policy that they have it over there, I believe one of the good policies that have taken is to provide vaccines in the pharmacy, which is quite unique in the Gulf countries. And quite interesting to see this sort of action had been implemented, which is a really, I hope other countries, Gulf countries, could take to facilitate uptake of this vaccine, particularly among non-nationals. While looking at, this is a study that has been implemented 2001, and it seems to be, this is the influenza vaccine is the one that mostly the physician in UAE are advising their patient to take the vaccine. So compared to other vaccines that have already in the system. So hopefully they will able to have a high vaccine coverage rate this year. Well, looking at the Saudi Arabia, again, Saudi Arabia already started the campaign sometime last month, and targeting all the high risk groups that we know them very well, and looking at the vaccine coverage rate over particularly the last year, the year before, it seems to be showing a very low coverage rate, which is 43.5. And the other region, for example, reached 44.14. So in general, we could see despite of having the facility and having the vaccine in place in Saudi Arabia, the vaccine uptake is not up to the standard. And this is another study showing looking at the knowledge, attitude, and practice, showing the overall vaccine coverage rate is almost 12.6 in 2016, and a lot of hesitancy that has been seen among the physician towards advising their patients in taking the vaccine. Well, this is a quick, I'm going to go through the impact of influenza in times of COVID-19, because I believe these experiences during a COVID-19 had impacted particularly the current season. And this is data that has been collected in Saudi Arabia during a COVID-19, and we could see there's a significant correlation between increased coverage, influenza vaccination coverage, and decrease of COVID, which is, I believe, this is quite interesting. But even though we also see a low coverage among different age group over here compared to the previous one, which was pretty good. So somehow the COVID-19 had those who had received the vaccination had a lower incidence or complication of COVID-19, as well as we have experienced a low uptake of influenza among high-risk groups. This is another study in Saudi Arabia looking after the coverages and severity, and showed that the severe COVID-19 cases were less among vaccinated patients than in non-vaccination patients. And this is another one. The incidence of affection with COVID-19 was much lower in vaccinated. So a number of these studies that have been shown that, you know, the vaccination do somehow reduce the severity of COVID-19. And this is another study showing the impact of seasonal influenza in times of COVID, look at as a severity, and show the co-infection in COVID-19 patient with influenza and increased COVID severity and mortality. It seems to be somehow has really reduced with uptake of influenza. And this is the same results that we have seen in Qatar as well. Well, one thing that we also seen in this study in Saudi Arabia, that somehow COVID-19 during that particular period increased the hesitancy of Saudi participants in uptaking of influenza vaccine. That's why this season is going to be quite tough for the countries to really prepare enough for the campaign, to put more efforts in order to increase the uptake of influenza vaccine particularly among the high-risk groups. While looking at one thing which is quite unique in our region, which is Gulf region, as you could see, the Gulf regions, in fact, is the hottest and the highest prevalence of diabetes globally. And we know that the relationship between the diabetes and influenza, it does cause and cause a lot of complication among diabetes, as well as COVID-19 that has been already shown. So we are here in the Gulf country really pushing a lot that this, particularly in people who are suffering from diabetes, should be really looked after in providing the vaccine. Otherwise, they are really going to go into a lot of complications. And we have published a paper around that to facilitate a lot of awareness among diabetes and relationship between influenza diabetes during COVID-19. In summary, I could say, this is the last slide, Dr. Faris. While the implementation of non-pharmaceutical intervention to control the COVID-19 pandemic have really impacted the spread of influenza during the pandemic, but that activity, COVID, has already gone now, and now we are really suffering exaggerated post-pandemic influenza transmission, which is quite tense, and it's going to be much tense than that we have already experienced in the future, and probably this is due to the immunity gap that has been taking place over the last 2 years, And we know that as of now, which is something good, most of the Gulf countries do have universal influenza vaccination. But again, that policy hasn't been good enough to increase the uptake of the influenza vaccine among or across the high-risk group. So we do have exaggerated hesitancy in among the high-risk group and others as well. And of course, it was during COVID, and now it's going to be there. But hopefully, by this year, the countries are really taking a lot of efforts in increasing awareness and increasing and different tactics in reaching the targets. So extra efforts need to be done at the community to regain the trust of the influenza vaccine. So by this, I would like to thank you for your attention, and hopefully I was quite helpful in providing what is the current situation in the Gulf country. Thank you so much.
Thank you so much, Dr. Salah, for this very nice presentation indeed, and thank you for your last slide indeed that addressed two questions that have been raised by some of the colleagues. One of them was asking why the influenza vaccine was low during the COVID time, and I think your first bullet in the last slide had addressed that very clearly. Probably it is the use of the non-pharmaceutical intervention, particularly the PPEs, may be behind this issue. And the second was about why we may expect a severe season, which I think the important and the strong message that we received from the two presentations that we are entering a serious season indeed, related to influenza, probably because of the vaccination gap that you just mentioned, because of the low vaccine, low influenza in circulation during the COVID time, and probably this will lead to some immunity gap, which can make the coming season a serious one. Also, the third important point, which I think again is going to be addressed more thoroughly with Macron presentation, is about the hesitancy that COVID had raised. So allow me now to introduce our third speaker, Margaret McCarron, and she is going to talk about influenza vaccine hesitancy through effective communication. And allow me, just because the bio had been changed while here, so one few seconds, please. Yeah, so Margaret McCarron is an epidemiologist with the influenza division at USCDC in Atlanta, and she has worked in influenza for over 12 years, providing technical assistance to partner countries on the establishment and expansion of the influenza surveillance. And this work helped to establish the presence and seasonality of influenza, as well as the global and regional burden. Building on that work, Meg began working with partners to develop evidence-based influenza, influenza surveillance, and this work helped to establish the presence and seasonality of influenza, as well as global and regional burden. Building on that work, Meg began working with partners to develop evidence-based influenza vaccination policy, expanding access to a vaccine. And one of the main areas that she worked with is with the WHO Eastern Mediterranean Office to advance influenza vaccine use in the region, working with colleagues to develop a roadmap for expanded influenza vaccine use in the EMR. Sorry for that, but again, the floor is yours, Margaret, for 15 minutes if possible, and to have the question and answer later on. Thank you.
Hi, thanks so much. And I am just trying to change to presentation mode. Give me just 1 second and I will go as quickly as I can so that we've got time for questions. Do you see my screen?
Perfect. Thank you so much. Perfect.
Okay. So good afternoon. Thanks so much for letting me join you this morning. I'm going to keep this brief so that we have time for questions. And I think a lot of what I said, I had planned to say, my colleagues have said very well. So as Dr. Faris said, the flu causes severe complications in some population groups, and infection with flu can cause hospitalization and death. Flu vaccines are recommended for health workers, pregnant women, children 6 to 59, months of age, persons with underlying chronic conditions, and older adults. And what's notable about this is that these are groups that aren't traditionally reached by routine vaccination programs. And so this presents special challenges because they're not used to routine vaccination, which leads to hesitancy. So they're a hard group to reach because they're not used to being vaccinated, but also because flu happens every year. And so that's an extra hurdle, diverse targets, and therefore there's more need to vaccinate every single year. And so this low uptake can lead to higher disease burden, bigger strain on the health system, and more severe outcomes in risk groups. And so the EMRO regional office wrote a paper this year, putting together a roadmap for increasing uptake of flu vaccines in the region and access. And they did a literature review and found that these were some of the most common causes of hesitancy in these groups. And so though they're variable across groups, I think there are a few consistent themes: lack of knowledge about flu virus and influenza vaccines, and a low risk perception. Risk perception is often seen as one of the biggest drivers of vaccine uptake. And a lot of those groups felt like there's a lack of information about flu at all, and flu vaccine specifically. And of course, like with all vaccines, a lot of worry about vaccine safety and side effects. But given the diversity of these risk groups, it's really important to know how to reach them all. And so getting to know how you reach your risk groups, what their knowledge, awareness, and perceptions are, what their perception of risk is, like I said, where they get their information, how they make their decisions, and what kind of existing challenges there are or existing beliefs that you could target for change. And then thinking about who influences them. So the target groups might be a little bit different in terms of who their influences are. They might be religious groups, they might be peers, Ministry of Health, the media. And so using all of these different channels is important, but then also using tailored messages to reach them. A pregnant woman might want to hear something different than a health worker, than a parent, than someone with chronic disease. And so making sure you get the right messages to the right groups is critical. And so using the right channels with not only the right messages is also really important. So broadcast media, handouts in medical facilities, TV, social messaging, health worker communication. We've learned a lot in the COVID-19 pandemic about how to reach different groups, and have seen some novel innovations, including sort of town square types of events, house-to-house visits, mobile buses. And so leveraging all of these different ways to reach your groups is critical, as well as leveraging existing partnerships within the healthcare system and elsewhere. And so health workers are a key influencer. They're the primary touch point for most people with the healthcare system. And so understanding their hesitancy toward vaccines is really important. Generally, health workers who get vaccinated themselves are more likely to vaccinate their patients. And so increasing uptake in health workers is really critical on top of all of your other ways of targeting your groups. And so health workers have a higher influenza infection rate than other adults. They can transmit to their patients. They can have absenteeism. Like I said, health workers who are vaccinated are more likely to recommend vaccine to their patients. In a study we did of health workers worldwide, I stratified by the EMR, and these are the groups that were most likely to have recommendations for flu vaccines from health workers. And then we looked also at the health worker understanding of flu and flu vaccines. And so you'll see the blue bars are the yeses, health workers agree, the orange bars are disagree. And so I highlighted just a couple of key things. and then knowing where they get their vaccine recommendations. And so I highlight this study mostly because it gives you a sense of how you can get information, looking at surveys, understanding what the hesitancies are, how to reach those groups most effectively. And then to talk briefly about COVID and flu, so the twindemic poses a really big problem, healthcare resources, et cetera. Though the two viruses can present similarly, they're not the same. And so there's some misunderstanding that that COVID vaccines can be effective against flu, but they cannot. And then there are, of course, concerns about the co-administration of both vaccines. So messaging among those same channels, reaching populations the same way is really critical, and making information basic and easy to know. And so conclusions, you need to know your audience and tailor your messages. You need to know how they access their health information and make sure you get it to them through their channels. And then who influences their health decisions, where do they get their information? So keeping it very brief, finishing us out at 10 a.m. just on time. I'll stop there. Thanks.
Thank you. Thank you so much for this very concise and still very informative presentation. Thank you. And I think we have some questions that have been raised in the Q&As, and some of them have we already mentioned. But I think the most important probably message that I personally conceive from the three presentation, once again, because of a lot of issues that probably you are going to address, we are entering a very severe season regarding the influenza, and from the as we know, probably the main weapon that we have in hand is the vaccine, which again, I think with the current status of the vaccine hesitancy, particularly after COVID that had been seen from different countries, I think countries need to do a lot in order to combat and to be very well prepared regarding the coming time, particularly this region, probably different from many other regions in the world in terms of the large number of IDPs, refugees, countries with political and civil unrest. So all these are probably going to augment the morbidity, potential mortality that can associated with this in the coming season. One question, Dr. Noor, and for all really, and really I personally thinking during the COVID time, there was rapid expansion in terms of the laboratories, in terms of the equipments and so on in testing for COVID. That's in no time, almost all the countries, instead of having 1 or 2 or 3 laboratories, all of a sudden they have tens of laboratories that can do the testing. But still, really, in the area of influenza, we don't have this capacity in order to identify where we are. The second issue that currently we are probably facing not one pathogen. A very recent article that had been published in BMJ, a very short article indeed, they are describing as if we are 3 epidemics at the same point in time. We have the respiratory syncytial virus, we have the influenza, as well as the COVID. So all of them, they will come in probably in this season, which is again, probably they are going to make things worse. So from your perspective, what do you think, why we don't have this rapid availability and the growth in the tools and kits and so on regarding the influenza, just like what we saw with the COVID, and which I think it can help a lot. Dr. Noor, what do you think?
Thank you, Dr. Faris. It's a legitimate questions. It's a very valid questions, and we all struggle to understand these, and we do understand. We know from WHO side, we are promoting integration of multiple viruses from the lab surveillance perspective. So we are heavily now focusing on countries to understand, acknowledge, and work in terms of the lab capacity building, and we are providing the lab, what do you call the detection materials, so that they are able to detect multiple pathogens in one go, instead of doing it separately or refocusing or focusing depending on the country's priority or preference. So the countries are now able to use the laboratory capacity to detect multiple pathogen in one test, the effort. So the COVID, SARS, the SARS-CoV-2, MERS, RSV, and other pathogens. It's possible to have a multiple, I don't know exactly how many, but it's possible to do all these major pathogens, the respiratory pathogens, as well as the other the pathogens as well that are potentially severe for respiratory viruses. So we're promoting this and increasing capacities. As I mentioned in one of my slides, that we recently sent a couple of missions to countries as part of the bigger mission, ultimately to include all member countries, 22 member countries, for integration of multiple pathogens in their surveillance system, both from the lab perspective, from epidemiological perspective as well. As you would understand that during COVID, the effort, preference, priority, all resources were invested for COVID, as if there is no other viruses or no risk of any other things. But it's partly to do with the country's preference, the pressure, and partly also the lab capacity point of view, which WHO is now working heavily and providing support together with our strategic partner with CDC, so that the laboratory have the capacity to do the multiple virus detection. Over to you.
Thank you so much.
Faris,
yeah, please go ahead, Dr. Salah. Yeah, please.
Quickly, I totally agree with Nuri said that, well, once the COVID has really going down, the momentum has been somehow vanished by the authority and all the system that, they went back to the, pre-COVID, in fact, some of the countries. And I know the WHO is trying their best in order to facilitate to maintaining this. And this is going to be quite hard for the WHO and for the country as well, because the momentum, the COVID is a momentum where are all the country, all the efforts, and now things, they're going normal, and by default, the country, they started to not feeling going into that direction of doing everything all together. This is one. Well, the Gulf country are now experiences influenza and RSV as well. I'm telling you, we have a lot of cases that, but doesn't go very well with COVID. COVID, we are seeing really going down. But these two, RSV, influenza, and other influenza viruses are really causing a lot of a huge burden. And it will be very interesting, even, and this is again, I think I'm compliment with the Nuri, that, that the country are not looking at their data efficiently and timely. And very crucial to look at where are we going and what are the support that you needed from the WHO or from the country, and then you need to start fighting. Otherwise, we'll go back and live in the same environment that we were before COVID-19, and that is not helpful. I'll stop over here.
Thank you so much. Again, I just to stress your point, Doctor. But again, I think using the momentum of the COVID and how everything have been assigned for COVID because of the pandemicity and else, but still, I think showing the people the numbers, the exact proportion of the cases that have been hospitalized, for example, or caused death, or etc., etc. I think this is going to make a very strong message to the population and make them more compliant to have the vaccine as well. As Dr. Noor had mentioned, there are a lot now, in fact, not now, but years ago, panel testing for multiple pathogens are available. And they can test even for 30 pathogens at the same time related to respiratory infections. So using all the facilities and the technologies that make everything easy for the COVID testing, I think this can be invested in some way or another with the other pathogens. Just like what Dr. Noor mentioned, one time we are working with COVID, but during some coming time, we are probably faced another respiratory pathogen with threatening that can go into epidemic or even pandemic. So again, this is, I know what part of the lessons learned from the COVID, how to leverage all the effort and the scientific advances and engaging everybody there. I think this can make a lot of good preparation for the coming time to combat probably coming pandemics or epidemic. Again, I think the issue probably of the scientific independence, away from the financial benefits here or there. I think this is something that we need to discuss, at least in our professional forums and so on. So thank you for so much. Really, this is from I always think about this, why we don't invest in this area. I think we lost Meg. I don't know if she's still with us or we lost her. Unfortunately, she's not here anymore. Although I think this is the issue that she raised, I think very important. But as far as she has some collaboration with the IMRO region, Dr. Noor, what are the most important messages that we can communicate to our ministries of health, our people working in health in our countries regarding the vaccine hesitancy? In some countries, like my country, for example, Iraq, there was a big problem regarding the vaccine hesitancy, and unfortunately, the coverage with the COVID vaccine was not very much below the expectation, and it was really substandard. So, what are the direct messages that we can convey to the Ministry of Health and our colleagues there?
I think the messages.
You are muted, Victor. No, yeah. Okay. That's okay now.
Can you hear me now? Yeah.
Yes.
Okay. Thanks. Yes. Thanks for this very important question. Yes, I think it's very important that it's not just the public education awareness is very important. I think this is the primary, the initiative that should be addressed to for the people's awareness. When the people are aware, I mean, people's power is something that, sometimes the political leader, if you go directly to political leader without much evidence or much stronger data or, so it's very difficult to feed them, to convince them. But the pressure should come from the bottom. I think it's better to start from the as a bottom-up approach rather than top-down approach. So if you go directly to the political leader without equipped, without being equipped with the strong evidence or data, then it is likely that it will not work. Or if it works, it is not much of significance. But I think the public awareness campaign, and during COVID, we saw that the many traditional groups that usually had a vaccine hesitancy, population group, and also the region of, some countries, they know that which area are very much non-receptive of vaccine. They did very well during the COVID. Why? Because we had evidence in front of us about what COVID, at the peak of COVID, how it destroy the whole society, not just the people's life, but also the social fabrics of the the society, travel restriction, for example, business collapse, and everything. So the people need to find a way out, and the strong message was that yes, indeed, COVID vaccine would not guarantee you that you will not have a COVID. But one thing is very clear, that the severity of the disease would be much less in terms of hospitalization, ICU, the needs, or death is very low, very few. At least in countries, many countries, these messages were well communicated to the people. And as a result, the vaccine uptake was higher during the COVID. But as the COVID has now subsided, so coming to the influenza, the seasonal influenza vaccine, it is very important to have a strong evidence collection and sharing this in easy language, and so that people understand, political leaders also understand the value of vaccination and why it is important that we keep updating every year, taking new vaccine and seasonal vaccine, the uptake. So I think the information, the data collection, and also writing up the story, this is very important, so that it used as an advocacy material to go to the policy level, to the policy leader. I'll stop here. Thank you
so much. And I think one of the area probably that we need to show that both the public as well as the policymaker is some evidences, as you mentioned, to develop an evidence-based decision. I think we need some sort of research in this area to identify exactly who received the vaccine, who didn't receive the vaccine, and what are the barriers, what are the bottlenecks from receiving the vaccine, which I think is quite important in order to showcase and to show the to identify where are the gaps and how to work on these gaps. I think, Dr. Salah, you did present good number of these research workers from the GCC countries. So I think you can say something about the role of research work, particularly. I think we have good number of audience from the FETPs in the region, as well as people who are interested in the research work as well. So probably this area can be very rich and fertile area for research work.
Yeah, thank you very much, Dr. Faris, for the question. And if I may, I'm going to complement with the previous question and then quickly jump into the current one. Well, the COVID pandemic, the situation of COVID pandemic is totally a bit different approach in terms of increasing awareness about uptake of the vaccine compared to the seasonal vaccine, because that the momentum and the situation is totally different. The influenza vaccines is a bit because this is a seasonality and it has its own way of approach. And one thing that Margaret, I think, said it, which is, I believe, is the right thing, and is what we call using the right channel. And I believe personally, healthcare workers are the best people who could really convince an individual community to take the vaccine. And I'll give you an example for that. Of course, we do a lot of public health awareness. That doesn't work anymore. Honestly, in my own opinion, community awareness is nice, you could do it, but it doesn't work anymore, it doesn't fly, and people do not buy that anymore. But we have, this is what we call the right channel. All the high risk groups, individuals are really going to the physician by default. For example, diabetes patients are going to diabetologists, and we do not approach these diabetologists. We keep talking to the other individuals. The people who are suffering from kidney diseases, we are not communicate with the physician who are suffering from kidney diseases. So the patient goes over there, he's the one who trusts the doctor, really trusting that diabetologist or renal disease, doesn't hear that. And he go to the physician, he may not go to the physician because he doesn't need to go over there. So what I'm trying to say, we need to be very focused in try to increase the awareness and the right awareness among key healthcare workers who really gonna pass those messages to the right individual who are really needed that vaccine. That's a message over here. And this is what I've seen. For example, in Oman, we have reached almost 90% coverage among pregnant women. Why? We haven't done campaign, just we have focused in advising the nurses who are really taking care of pregnant women. Please pass this information one-to-one. When the pregnant comes, you provide the information here and she understands one-to-one. And they were really taking the vaccine very easy without doing any huge campaign, because we are dealing with the human touches over there. So, and this is similar for the other diseases as well. So going back to your question, Dr. Faris, I totally agree with you. There are a lot of areas that need to be done in our countries to implement a lot of research, to be a very specific research here we're talking about. Don't talk about broad. I think now, there are a lot of research that has been done, what the community would, but go to the very specific, whether the diabetologists do have enough knowledge to pass it over to the right people. This just is an example. That's very specific. And go to that, to all these physicians who are really, do they have a knowledge that this is one thing? And this is very, CAP survey could be done very easy among these individuals. And you know exactly that, as exactly what you have said, they need information. We need to provide them information. Go and provide them information, okay? Because these are one who really gonna do the right, passing the right information to the right patient, and they will the acceptance high rate of acceptance will come over here. And this is why in the Gulf country we don't get the high rate, despite of availability of vaccine for more than 10 years in all the primary care. But these patients do not go to the primary care, they go to the tertiary care. they go to the hospitals, you know. So there's no vaccine over there. And you're going to ask that diabetology who's 70 years old, please go to the primary care? Nobody going to go over there. Who's going to take that old man to send it to the primary? And then, you see that? So there's a lot of small, minor things that we could do it in our system to make it happen without going to the big issues. But again, I'm talking about countries like Gulf country where the vaccine is already available, where I'm sure, Nuri, there are a lot of embryo countries, they are not even, there's no way that they could have a vaccine in place now. So that's a different story. I'll stop over here.
Thank you, Dr. Salah. Really, you crystallize it in a very nice way indeed. These traditional way of disseminating knowledge to the people, using the pamphlet sometimes, or these spots or so on, which are not focused on specific groups on whom we are targeting. Really, sometimes this is I totally agree with you. Could be only a waste of money and a waste of effort and waste of time. And I think going to be more focused, targeting the people who we need them to be vaccinated. I think this is the best approach. But it needs good, let us say, planning, good micro planning sometimes, in order to focus exactly who needs to be educated and how to educate them. And I totally agree with both of you regarding the healthcare worker who can be the mainstay of in this activity, simply because from two directions. They are a role model for their patients, and secondly because they can be infected and they can infect other people as well. So in targeting those groups, I think this will be of great value for them in particular, to keep them healthy, to keep them in work, as well as preventing infection to others. Meanwhile, they are going to advocate others to have the vaccine. Again, I think this is another important message that we need to convey to ministries of health in the region, to adopt this approach instead of the classic wooden type of health promotion, health communication, which is, I totally agree, it could be an old-fashioned. There is one question I'm sure probably for many people they are aware of the answer, but I have to raise it because it had been, that's what are the challenges of having a universal influenza vaccine? Honestly, I didn't understand exactly what he means by universal. Probably he means having one single vaccine for all the world. I don't know, but what are your reflection here, Dr. Noor or Dr. Salah, about this part? Probably you saw it in the Q&A.
You like to go ahead?
Go ahead, please, Dr. Salah.
Dr. Salah, you go ahead, because you have got the universal vaccination in GCC countries.
In our countries, when you say universal, it means every individual has the right to go to the primary care and take vaccines. And this is very well been implemented in Saudi Arabia. Very well. I mean, you know, you could go, anybody, whether you are national, non-national, whatever your age, go to the primary care and take the vaccine. In the rest of the Gulf country, they really focus on high-risk groups, at least for the time being, because maybe because of the limitation of the vaccines, because they're not available across. So they focus on these high-risk groups that we know them very well, at least at the beginning of the seasons, okay? And then whatever left over, and then they will ask the other groups that please come over and take it. So this is the difference between when you say universal and non-universal. It's simple.
Thank you so much. Again, I think just, go ahead, Noor.
I totally agree with Dr. Salah. I think those who those have resources and those who have sufficient vaccination to cover all people, all populations, they just open up their universal vaccination policy. Whereas in other countries, for EMRO, for WHO, different countries in our region have different sort of capacities. Many countries, as you said, Dr. Salah, in the Gulf countries, majority of the countries have the capacity to run the universal vaccination, even for the non-citizen, those who are resident in those countries. Whereas the countries with the fragile, the political and economic capacities, they have to ration the vaccination according to the risk group. So they have to prioritize, and this is how we do, and promote that at least the high-risk group should be vaccinated in the first place.
Yeah.
Thank you.
Yeah. Thank you so much. Thank you so much. But again, we have to consider that some countries, they do have the vaccine, but unfortunately they cannot dispose the vaccine to the people, and many times it ends either with being expired or left for. This is a real problem in many countries, indeed.
Absolutely.
And again, regarding your point about the national and non-national, again, I think this is quite important, because here we are talking about prevention of the disease, not only among the national, but vaccinating the non-national will protect the national as well.
Absolutely.
Yeah. So again, I think this needs to be considered as well. I think I didn't see any more questions have been raised here, but I will leave the floor for Dr. Salah and Dr. Noor to say final statement about the issue of the influenza in the region, and everyone have 2 minutes for that, if you would, please.
Go ahead, Nuri. Then I'll go ahead.
All right, thanks. Thank you, Dr. Faris. I think the key point here is when you look at influenza is very uncertain, the virus, and because its behavior is uncertain, because every year influenza can be in a different types and different categories. So the risk is very, the assessment of risk in advance is almost impossible. We don't know what's coming up. So what we can do is, the best we can do is taking personal protection as well as community protection. So personal protection is definitely, vaccination is the number one that should be considered. Personal hygiene, also the checking, testing. If you have influenza, like illnesses, go and test and isolate yourself if necessary, and take the personal protection. So during COVID, even now, the mask use, the compliance of these kind of use, hand washing, mask use, these are proven, the beneficial effect in terms of when it comes to prevention, very, very effective. And during COVID, I think one of the questions raised, and I answered that question, that why during the COVID, the influenza case was almost like non-existent. Because of this, because at the height of the COVID, everybody was so scared, and people have a high level of compliance in most countries. So it works. I mean, it works for both COVID, influenza, and all other, transmissible person-to-person transmissible viruses. So the key message here is vaccination, personal hygiene, and also the community awareness, education, advocacy. These are all equally important. No single measure can be effective when it comes to the population level prevention or protection measures. So everything should go at the same time, and this should be our effort, and we should work together jointly with the countries, within countries, and across countries as well. And that's the WHO's key messages. Over to you. Thank you.
Thank you so much. Dr. Salah, please.
Very quickly, I'm very much in line with Nuri, is that definitely influenza is uncertain. We don't know how the viruses would react, but for this year, as I think Dr. Faris, we all agree that for this year, we're gonna experience a very devastated influenza. There's no doubt, whether we like it or not. And we need to, as much as possible, to protect our community. And as I've already said, informed that vaccination is ideally, but if we don't have vaccination, non-pharmaceutical intervention are important. Particularly we as individual, if somebody is suffering from influenza, you could just wear a mask and try to protect yourself. And then in addition to that, healthy, reducing the burden in the hospital, or what we call it, infection within the hospital, is quite important, and which is I like it. In our hospital, as of now, going to the hospital, you need to wear a mask, not only because of COVID, because influenza as well. And this is very easy. You are really going to come to the environment where you're going to get. So wear the mask when you get into the institutions to protect yourself and protect others. That's very, very simple. And the last thing that I think we already agreed, focus again in terms of healthcare awareness on influenza. Although we would like to do all these traditional way, but the key to success, whether you have the vaccine in your country or this is in a private sector or whatever it is, I think healthcare worker would have a paramount direction and moving the community towards taking the vaccine, as well as adopt the non-pharmaceutical intervention as well. I'll stop over here. Thank you so much.
Thank you, Dr. Salah, and thank you, Dr. Nouri. Really, I would like to echo what you mentioned about the uncertainty of the virus in general, particularly the influenza, because we have a lot of H's, we have a lot of N, and bringing any H with N, we are ending with a new strain, and we cannot predict what will be the behavior of the new strain. It could be just like H5N1, which is highly lethal, or it could be something milder. So there is nothing can be predicted with viruses. The only predictable things in viruses, in influenza in particular, is its unpredictability. So we can put it in this way. I think, again, probably the strong message, once again, I repeat it quite several times, but I think from the preliminary findings from the Southern Hemisphere, as well as the early finding from the region over the previous weeks, it indicates that we are entering a harsh season. So at the end, I would like to thank our distinguished speakers, Dr. Nouri, Dr. Salah, and Meg, and unfortunately she left the area. And thank you to all the audience for their time and being with us. And hopefully we are going to meet with another important topic with the WEBi series that Internet are currently doing over the last 2 years, almost 2.5 years. Thank you so much. Have a good day. Bye-bye.
Thank you, Dr. Faris, and thank you, Dr. Salah, and everyone, and the organizer, plus the audiences. Thank you very much.
And thanks for my colleagues behind the scene. Thank you so much.
Yeah, absolutely. Thank you so much, and keep in touch. Bye.